Together we achieve victory over heart failure.
Hi, good evening, friends. I am Dr. Asit Khanna. I am the principal cardiologist and the director cath lab in Yashoda Hospital, Kaushambi, Ghaziabad. And today I'll take 3-4 minutes of yours to talk and dispel some doubts about heart failure. You see, whenever some doctor says you have heart failure, it is taken as if it is the end of life or end of the line. But what does it mean when a doctor tells you that you have heart failure? See, a diagnosis of heart failure means that your heart is weak. It is not able to pump blood as much as it should. So it is, although frightening, but it does not mean that life is going to finish in few weeks or months or years. It just means that you have to wake up to the fact that you have to start countering the reduction in ejection fraction. Get your echo done to check your ejection fraction and make sure that you do all those things which increase your heart function. Secondly, the very important thing, many Indians are affected by heart failure, and that is why I'm talking about it today. You must have seen in a lot of media that a lot of young Indians are getting affected, and that is because the diseases that cause heart failure, like hypertension, diabetes, obesity, smoking, lifestyle, drugs, vaping, e-cigarettes, and etc., along with genetics, along with pollution, play a major role. That is why Indians are getting it in large numbers. So, what are the signs and symptoms of heart failure? Please remember the 5 or 6 cardinal heart symptoms are breathlessness, chest pain, swelling in the feet or all over the body, palpitations, and sometimes you faint and you may have tachycardia or palpitations. Along with this, you may have a lot of non-specific symptoms like confusion, fatigability, nausea, breathlessness only on lying down, breathlessness in the middle of the night, which makes you up in alarm. So, how do we tackle that? Yes, you have to get yourself checked up by a doctor, start cardiac medications, control your blood pressure, sugar, diabetes, and other risk factors. Obviously, do not take alcohol, do not take tobacco, do not smoke, practice stress management techniques, start daily exercise to maintain, and if you are overweight, to reduce your heart rate and heart beat and weight, and to get yourself checked up for any other diseases that may be contributing to heart failure, like thyroid, like anemia, like so many other diseases, which a doctor will easily tell you. Okay, so what next after a heart failure diagnosis? See, medical science has now come so far ahead that we now have a lot of medications which reduce heart failure by increasing the pumping power of the heart. Please remember, heart failure medications improve quality of life, longevity, followed by several devices like pacemakers, which are bioventricular pacemakers, implantable cardiodefibrillators, and heart valves repair, not just surgically but also percutaneously, which we have started doing since several years. They improve your heart function, reduce ejection fraction, prolong life, and also prolong the quality of life. If nothing else, we always have heart failure as the last option available to us. So please remember, risk of heart failure is 1 in 5 in both men and women. So please take care. Always be vigilant about the onset of heart failure. And if it is there, then make sure that you treat it aggressively, adequately, and quickly. Thank you so much.